Okay, good day, nurses. For today, let us discuss pleural effusion. Okay, pleural effusion is a collection of fluid. Yes, it is a collection of fluid. So, it can be water, blood, or pus. Okay, saan siya nagko-collect? It accumulate in the pleural space and it is secondary to other diseases. Okay, normally guys, meron namang fluid dyan in our pleural space. Okay, that fluid serve as a lubrication para when we inhale and exhale, hindi siya sobrang sakit, hindi siya mag-rub against each other. Okay, kailan ba dadami or mag-a-accumulate yung fluid na yun? Kapag meron kang complication due to heart failure, TB, pneumonia, and pulmonary infection. Kasi nga sabi natin kanina, pleural effusion, okay, there is a fluid accumulation secondary to other diseases. Okay, yun din ang sabi ni Brunner and Sudart. Okay, in pleural effusion, an abnormal volume of fluid collects in the pleural space causing pain and shortness of breath. Okay, pleural effusion is usually secondary to other disease process. Okay, ito siya guys. Okay, tingnan nyo, may collection of fluid in the pleural space. Okay, the space between your parietal pleura and the visceral pleura. Okay, now we have general classification of pleural effusion. It can be transudative or exudative effusion. When we say transudative effusion, it is accumulation of protein poor or cell poor fluid. Nangyayari yan guys kapag there is fluid shifting. Okay, kailan ba tayong magkakaroon ng fluid shifting? For example, meron kang congestive heart failure or there is a low albumin in your blood. Okay, ang tawag doon hypoalbuminemia. Okay, for example, sample ng transudative effusion, we have hydrothorax, meaning ito ay collection or accumulation ng water or serous fluid in the pleural space. Kaya nga siya hydrothorax, water. Okay, on the other hand naman, sa exudative effusion naman, it is accumulation of protein-rich fluid. Kaya merong protein-rich fluid when there is an inflammation that is happening. Okay, pag may inflammation, magkakaroon ng protein leaking saan in the pleural space. Okay, for example, ng exudative effusion, we have phytothorax or empyema, which is the accumulation of pus. Okay, hemothorax, which is blood. Okay, accumulation of blood in the pleural space, and chylothorax, which is also known as child leak. Okay, which is accumulation of lymphatic fluid due to leakage from the thoracic duct and lymphatic vessel. So ito yung general classification. We have transudative and exudative effusion. Okay. Now, the signs and symptoms, syempre, shortness of breath, okay? Kasi instead na air, yung nandun sa lungs, ano yung meron? Fluid. Okay, dahil fluid, yung accumulate dun, therefore, magre-result siya into unequal chest expansion and unequal lung expansion, okay? Unequal chest expansion due to decrease, okay, in the affected region, and unequal lung expansion, decrease on the affected side, and possible atelectasis, okay? And ano pa? Dahil may fluid doon, when you percuss, anong maririnig mo? Dullness, okay? Due to too much fluid. And normally, ano ba dapat ang maririnig natin dyan? Okay, when we auscultate the lung sound, it should be resonance. Kasi, di ba, there is an air. Pero, dahil fluid yun ang dun, ang maririnig natin is dullness, okay? When we percuss, okay? Now, for its intervention, okay, ang gagawin dyan is thoracentesis. Okay, for this one, guys, we have a separate video about thoracentesis. Okay, so thoracentesis, guys, is the removal of air or fluid at the pleura to re-establish the negative pressure. O, diba guys, para saan ba si negative pressure? Ang sabi ko, diba, yung negative pressure, siya yung nagpapa-expand ng lungs. It keeps our lungs inflated, okay? To allow entry air, then resulting in alveolar expansion, okay? Or lung re-expansion. So, kailangan natin ma-re-establish ulit yung negative pressure, okay? And our lungs are capable of regeneration, okay? Short-term centesis, okay, which is the direct removal of air or fluid at the third space, okay? For example, you have edema, ascites, or pleural pericardium, okay? Si diuretics naman, guys, gamot siya, okay? It can remove fluid from the blood vessels only, okay? Si diuretics, si thoracentesis directly tinatanggal yung nag-accumulate na fluid. Okay, ganito ang position the patient when undergoing thoracentesis. The physician will insert a large needle on the affected side. Tapos, i-aspirate niya yan. Okay? Now, the bag is placed at the bottom to allow drainage via gravity. Okay? The site, okay? Kung air accumulation yan, of course, yung air nasa taas ng lungs, at the apex of lungs. So, ang i-insert yung needle at the second or third intercostal space. Second to third intercostal space. Pag fluid naman yan, syempre mas mabigat, mag-a-accumulate siya at the base of the lungs. Okay? Like for example, pleural effusion, saan i-insert yung needle? At the 7 to 8 or 9th intercostal space, okay? Then, avoid puncture of other organs, okay? Anong organs na nasa right lung natin? We have the liver, the right side of our body, and sa left side is the spleen. So, you avoid puncturing that, okay? But the physician will do the procedure, okay? Our nursing consideration before the procedure, guys, is we check the consent, okay? Because this is an invasive procedure. Okay, mind you, guys, that the doctor will obtain the consent. As nurses, we will only witness the consent, okay? The position of choice for this procedure is orthopnic, okay? Orthopnic or tripod position like this in the figure, okay? Now, we will also give, okay, pain medications 30 minutes before the insertion, okay, para hindi siya masyadong masakit, okay? Then we orient the patient to stay still, okay, during insertion, okay? Then we instruct the client to exhale and hold his or her breath, okay? This is to prevent accidental puncture of the other organs, okay, during the procedure. And after the procedure naman, guys, ang gagawin natin, okay, removal, okay, confirm lung re-expansion via the chest x-ray. And upon removal, we instruct the client to perform Valsalva maneuver or bearing down, okay, mag-Valsalva maneuver siya, i-hold niya yung breath niya para pagkatanggal ng needle, walang papasok na air, okay? The rationale behind that, sabi ko nga, transient increase in thoracic pressure that will prevent air entry upon removal of the needle. Okay? That's all, guys, for thoracentesis. I mean pleural effusion. Okay? I hope you learned something. Thank you and God bless.